My name's A Markey. I'm at ASH in San Diego 2018, and I'd like to share some work that I'm going to present formally tomorrow that's been done in the Vandenbrink lab at Memorial Sloan Kettering in New York, where we've been looking at the role of the microbiome in chronic GvHD. So over the last decade or so, we've found that the microbiome has clearly got a relationship between post-transplant outcomes, and a lot of that focus has been on acute graft versus host disease as well as infections, because looking at the stool microbiome with regard to acute GvHD and bacteremia, bloodstream infections, which are an important complication for our patients, is a really logical, obvious place to look when we start studying the microbiome. Now, what we do know though is that we've started to find associations between the microbiota and almost every post-transplant complication. So acute graft versus host disease, severe infections, relapse and organ failure. What had not yet been studied though was the potential relationship of the microbiota to chronic graft versus host disease, and so I've been able to access a patient cohort at Memorial Sloan Kettering where we have really nice clinical data confirming their chronic GvHD diagnosis, and then I've been able to go back and look at stool samples from those patients from before they even started their transplant, during the time of their transplant course, and then later, so as they get to that day 100 mark. And what I've been able to find by doing targeted analysis of the bugs that are present in those stool samples is that there seem to be signatures in the microbiome from the pre-transplant samples that perhaps predict later chronic graft versus host disease. So I don't have confirmed mechanism yet, and this is associative data, but what we're finding is that perhaps even at the pre-transplant time point there's a signature of the bugs in the gastrointestinal tract that may lead to downstream chronic GvHD or be a biomarker for downstream chronic GvHD. I think the other really interesting finding is that when we get patients all the way to that day 100 time point, when a lot of the acute unwellness of that early post-transplant period is finished, we can still see a signature that is present in the patients who go on to get chronic GvHD that's not present in any of the other patient groups. And so that's when I compare those chronic GvHD patients to a case control match set, or when I compare them to patients who had acute GvHD or yet another control set where there was no GvHD at all. And so I think the overall summary of these findings is that there may be some time points when we can really focus on the microbiome of these patients and perform microbiome targeted interventions that might actually change long-term patient outcomes. And we haven't appreciated that before, we haven't had this data before. And so that's the work that I'm going to present in full tomorrow, and it's opened up a lot of really interesting things to start exploring further about how those organisms might be changing the immune system in the long term, and that's the future of the project.